Thank you for joining today's webcast. Dr. McDaniel is board certified in dermatology and serves as an assistant professor of clinical dermatology at Eastern Virginia Medical School, co-director of the Hampton University Skin of Color Research Institute, adjunct professor in the School of Science at Hampton University, as well as an adjunct assistant professor in the Department of Biological Sciences for Old Dominion University. Dr. McDaniel helped pioneer the science and theory of LED photomodulation and has been involved in the development of FDA clinical trials of some of today's leading laser and energy-based devices for cosmetic treatments or for non-surgical skin rejuvenation. He has authored many articles and book chapters in the field of laser cosmetic surgery, antioxidants, and anti-aging medicine. Dr. Weiss is board certified in dermatology and has been a featured speaker for the American Academy of Dermatology for many years, as well as presenting to other national and international audiences. A prolific author, Dr. Weiss is Clinical Associate Professor of Dermatology at Maryland University School of Medicine. He has served as President of the American Society of Dermatologic Surgery and President of the American College of Phlebology, and is currently Vice President of the American Society for Laser Medicine and Surgery. He has published extensively on many subjects, especially varicose vein treatment, lasers, and cosmetic dermatology surgery. We will now begin our featured presentation.
Picosure is the latest technology from Cynosure, and it involves delivering picosecond pulses. And picosecond pulses are an exciting new technology that has the shortest pulse durations ever created in a laser device. So what this means is before, the shortest we could ever get was a nanosecond or a billionth of a second, and now we can actually get a picosecond, which is a trillionth of a second. This has a lot of benefits for patients that we're now just discovering. The initial concept was for breaking apart tattoo pigment. That soon led to thinking, well, if we can break apart tattoo pigment, why not melanin pigment? Why not, sunspots, things like that? But then, with the addition of the focus lens array, we started seeing some really interesting things. We started seeing much more than the reduction of pigment. We started seeing textural changes of the skin, so much so that this process has been called revitalization. It involves a textural smoothing that you can see on patients. Their skin is much more reflective. The skin is a lot smoother. The texture is much smoother. And we see this in our very carefully controlled clinical study, which we're using very sophisticated devices to capture this by photography. What this new focus lens array does, it actually takes this picosecond pulse and it focuses it into hundreds of little beams. This lens diffracts the light energy and into these hundreds of little microspots, but it also delivers some background energy as well. So for each pulse that you're doing, you're not only getting sort of intensified energy into the area covered by the lens, but you're also getting some background. And we think this is one of the special events that's happening with this new focus lens array that is enabling us to do this new concept of skin revitalization. What we believe that we're seeing with the focus lens array and the picosecond technology is that it's more than just breaking down pigment. What we think we're seeing with this is that there's some sort of cell signaling going on that is triggering a variety of new mechanisms that reduce the photodamaged collagen and induce new, fresh, crisp collagen, but are doing it in a way that's entirely different from what we've been used to doing with thermal-based devices. We believe this is a sort of a cell signaling that's developed just on that very short pulse that somehow triggers a bunch of agents such as cytokines that are now triggering this revitalization process. The neat thing that we've seen with the Picosure, with the picosecond technology and the focus lens array, is that we're able to achieve skin revitalization in a way that typically was only available with the non-ablative fractional, or sometimes even ablative fractional, which both of which involve much more downtime, much more pain during the treatment. So we believe we're in the process of discovering and developing this technology with the focus lens array and a picosecond laser domain, that we can actually achieve very similar results with much less pain and much less downtime compared to the non-ablative and ablative fractional lasers.
We're seeing less pain, gentler treatment, less intense redness, much shorter duration of redness, remarkably less duration of redness. No real other wound care. We've seen faster, more consistent results in a fairly short time period. So it's obvious that there are different mechanisms of actions.
Well, I was going to grow old gracefully until I started looking old. Noticed the pores in my skin were getting bigger, and the texture of my skin was just was looking rougher, and I did not like it. And the treatment I had before, a fractional laser treatment, was very painful. It stimulated collagen, and yes, my skin did look better over time, but I wouldn't ever do it again. It was too painful. And I'd heard the Picosure wasn't painful. The time under the treatment was a lot less. And I thought, well, I can't go under the knife. This was a good alternative, and so I thought I would give this a try.
We're going to be keeping the focus lens array, which we have on the 6mm handpiece. We're going to be keeping that as perpendicular to the skin as we can, try not to be off at a tangent or an angle. We're going to be trying to stay as close as we can to the plane. So we're running at 10 Hertz, and we're doing approximately 10% overlap, although I believe it's fine to go as high as 50% overlap. And we're going to do about 4 passes total. So when we're completed the treatment on her face, the goal is to have somewhere around 4,000 to 5,000 pulses for the entire full face. We've actually been doing some people as high as 6,000. It's remarkably gentle and safe. So now we've completed that quadrant. You can see there's a little bit of erythema developing. One thing you'll notice if you're looking very carefully, one thing you can notice, you'll see occasional little sparks of little plasma forming. But notice the acoustic sound. This is the acoustic shock wave. If I back off and defocus, notice the sound disappears. So there is an audible cue here, if you're the surgeon doing this, that if you're following a contour and you start to hear the sound diminish, that means you probably are too far from the skin. It's a good little tip. And if you notice, we're going over some of her eyebrow hairs here, and you don't see a plume of smoke, you don't see singeing. Obviously, if we had a long pulsed alexandrite hair removal laser, we would not be seeing that same reaction. So you can see here again the same thing, the hairline. It is safe to overlap these blocks or quadrants some. What you don't want to do is leave a seam of untreated skin. And there are a variety of patterns of treatment that you could choose to use. There's nothing critical about what I'm doing, except that for me personally it's easier to do blocks or quadrants or anatomic units, simply because it's easier for me to keep track of it. If you notice, we do not have any reflective metal surfaces here, and we have anodized metal. We're going to go ahead and treat this area in the glabella now. And now I'm going to let you turn your head this way. I'm going to outline about a centimeter below her mandible here to remind myself to go there, because since she's partially recumbent, I want to make sure that although we have not ever seen lines of demarcation with the Picosure and the focus array, I want to make sure we feather. A lot of people have a little poikiloderma. So now that I've done that, that will be my red line when she develops erythema. And then I'll feather into that. So I'm going to just arbitrarily make a little bit of a block here so that I'll actually have some red lines, and then I'll just, you can see the erythema developing. I'm going to paint. One of the reasons I find this easier is I'm really moving my shoulder, and if you notice my wrist and hands moving more as a block. Because of the way the wrist pronates and supinates, if you do this, you're going to tend to not stay perpendicular, and I've found it's easier to go like this than it is to use my wrist motion. So it's harder to do large areas if you use that technique, and my goal was to try to keep the focus microdots, the microarray lens here, at its optimal focal point. And again, it's a very nice, easy technique. Again, I'm moving my shoulder more than I'm moving my wrist, so if you notice I'm staying very parallel, it glides along very easily. And I've been heavily overlapping the passes, so I'm at about 50% overlap. So 50% this direction and 50% that gives you about the equivalent of 4 passes. You could also do less overlap and more back and forth. Again, it's a matter of preference. Now this may be a little bit more sensitive, Pat. You tell me if you need a break. This is a pretty sensitive area. And again, I'm actually overlapping a very small amount onto the vermilion. And I am putting a few extra passes, so we're probably doing almost twice as many passes on her. A couple little tips here. You'll notice that her nose is not that red. We've seen that fairly typically on the nose, so it does not mean we didn't treat it. You can see she's developing a nice uniform erythema at this point. If you see this little light area here, that actually is the spot I intentionally left untreated. So we'll go back, retreat it. If you're wondering if it's safe to stack pulses this close together rather than larger sweeping areas, it appears to be, but if you notice I'm taking little tiny breaks between my 4 passes. Don't know if that's necessary, but again, we're being safe. You can see here now I'm going to flatten this and I'm going to get more perpendicular. And I'm making my 4 passes here. And we'll come back to that. We're going to come up and get my little mist area here. which I really did skip. And if you notice now, she's beginning to develop erythema where I had missed that. So if you recall, I was probably at this angle and a little off focus. Then I turned it in, and now you see more tissue reaction. And then we can treat a little bit of this area up here. We have our bony orbital rim as our safety backdrop. And she does have some pigment dyschromia there, so we'll treat that. And now we're going to switch sides. And I'm going to go along and with my little submandibular boundary line here like we did on the other side. You might glimpse a few of those little peach fuzz hairs flashing there. And then I'm going to let you I'm going to pull your chin up for just a minute. Let you turn back that way a little bit. So now that I'm not talking quite as much, I'm going to do what we normally do with private patients, which is faster than what I was showing earlier. And this gives you an idea how simple and easy and rapid the technique is. I'm still attempting to overlap some here. So we have a few final areas here where it's a little bit less red, so I'm just making sure I cover these uniformly. We're checking everything looks very uniform. We were at just about, the pulse count is just a little bit, it's about 2,500, so we did about 2,500 pulses here, so that would translate to about 5,000, which is in our 4,000 to 6,000 range that we're using our private patients. So we're all set. So what we've really seen is quite a big departure from the traditional clinical response. The immediate effects afterwards and also the clinical results. So what I've seen in my private practice as well as some clinical studies we're finishing is an unusual consistency of response. That is, we're seeing a very high percentage of the subjects in the studies and also our private patients, they see visible benefits in almost all the cases. And we all know a lot of the fractional and non-ablative treatments, there's a lot of variation results. So we have people we have to give free treatments to, we have people that we have to do additional treatments. What we're seeing is an unusual consistency. The second thing we're seeing is a very high degree of patient satisfaction out of about a month.
We've gotten really positive feedback from our patients because it's a relatively short treatment, relatively painless, maybe an hour or two of redness, typically at the most, and then changes in superficial texture. We think from these initial results in the study that we're doing at our site that this is going to have broad applicability to many patients who want to have revitalization, want to do it with relatively little pain and relatively little downtime.
Thank you for attending this webcast. You can learn more at the American Academy of Dermatology meeting, March 22nd through March 24th, 2014 in Denver, Colorado, and the American Society for Laser Medicine and Surgery meeting, April 4th through April 6th, 2014 in Phoenix, Arizona. And you can also learn more at Cynosure.com.